Well, in some way, mental illness touches everyone. And for children especially, the statistics are pretty sobering, with 1 in 5 kids living with a mental illness. So Franklin County Children's Services and Nationwide Children's Hospital are on a national mission to break the silence surrounding children's mental health. So I'd like to welcome today Jessica Allen and Alex Bishara to share more about the On Our Sleeves campaign and really what you guys are doing to open this conversation. It is very sobering, though, to think about how many children are affected. Do people even realize that, Jessica?
It's something that I don't think people talk about, and I think as we're moving ahead in society, it's becoming less taboo.
Sure.
And we can start talking about it more, but I feel like people are missing the boat that children are affected just as much by trauma and mental illness as adults are.
Absolutely. So you're a supervisor for Children's Services, so you work with children who have experienced these type of situations. So how do you, first of all, get them to open up, get them to express their feelings? Because even as adults, that is probably the hardest thing for us to do, right?
Absolutely. So building a rapport with our children to talk to them and engage with them, because we're talking to them about really personal, scary topics.
Yeah, heavy stuff.
Absolutely.
Kids,
so when a caseworker goes out to interview and speak with a child, I mean, they're essentially strangers. And unfortunately, there's the stigma associated to child welfare workers. It's kind of scary and anxiety inducing. So we really want to work on building a rapport, finding just some kind of in to get in there and talk to the kids. So, I would suggest starting talking about, what their favorite food is to eat, something that they like to do after school, a favorite activity. What we've really started using now is we've worked with the therapy dogs that are offered through the law enforcement department. So Franklin County Sheriff's therapy dogs, Columbus Police just rolled out with their 4 dogs. So bringing the dogs along has been an excellent resource to help us gain that buy-in and really get a disclosure from children.
And so once you have this conversation, how do you know that they are experiencing a mental illness, or that they do need a little more help in some aspects?
Well, we work with parents and caregivers as well, and so we want to talk to them, listen to see kind of what kind of behaviors they're describing. We're looking for any kind of behavior or mood changes in the child, maybe a child that has difficulty concentrating, any intense feeling changes. So if you've got a child that's become really overly anxious, expressing a lot of fear, so much so that it's impacting their daily routine. We look for substance abuse issues too. A lot of times kids will start experimenting and abusing substances as a way to cope with the feelings.
Yeah. All right, Alex, so to that end, Nationwide Children has joined in the effort with this On Our Sleeves campaign. So tell us about it.
On Our Sleeves is really a movement to transform children's mental health. And so we know that of all these, especially the 1 in 5 children who have a significant impairing mental health disorder, less than half are getting the treatment that they need to learn how to cope and be successful with that disorder. So On Our Sleeves provides tools and resources to families and communities for how to raise awareness and break stigma that can really contribute to early detection and early intervention of mental health disorders, which is so important for a child's development.
Yeah, any quick tips for maybe a parent, tips that are in this campaign to get them to notice and to start that conversation with their kid?
Simple conversations actually provide really great opportunities for children to learn how to talk about these things. So On Our Sleeves provides this one resource called Conversation Starters. Things like, tell me about the best thing about your day, or what's one thing today that happened that you feel very proud of. And so these offer kids an opportunity to learn how to talk about their thoughts and feelings, as well as parents the opportunity to reinforce that social and emotional resiliency that's so important.
And these open-ended questions is vital, because any kid's going to say yes and then run to their room, but you can't let them get away, right? You got to really engage. Jessica, so these partnerships obviously important to FCCS. How was it to feel that you guys joined in on this?
Yeah, our partnership with Children's Hospital is so important. I feel like we're both in the business of working with children and families who, unfortunately, we come into play when they're at the lowest of their low. And so in partnering with Children's Hospital, we use them as collateral support and collaborate, because getting the information from them can help us a lot of times in our decision-making process, and with children.
And so getting involved with the campaign, having questions about it, what's the best way to reach out?
The best place to start is with onoursleeves.org. We're actually nearing our 1-year anniversary of our kickoff. We've had about 500,000 engagements on the website. We've had over 11,000 people join our e-community. So there's really a lot of opportunity there to develop tools and resources for your own family, for your community, as well as your place of employment, your child's school, really a lot of things that can help raise awareness and break stigmas.
All right, absolutely. So proud of the work you guys are doing, and thank you for sharing it with us.
Thanks.